Hey guys, welcome back. I'm Dr. Josh Rucker with Rocky Top Chiropractic. Today I want to answer your top questions, so let's get right into it. Number one, does chiropractic help with sleep? So two main points I want to point out about this topic. And so number one, if you're having trouble sleeping due to aches or pains, or you can't find that right comfortable position, it may be due to a misalignment somewhere in your spine. Chiropractic can absolutely help in that regard. Now, second of all, you have two types of autonomic or automatic nervous systems, and that's called your parasympathetic and your sympathetic. Now, your sympathetic is your fight or flight nervous system, and the parasympathetic is the rest and digest. Now, when we have misalignments or what's called subluxations in our spine, it can actually affect what's called the tone of your sympathetic nervous system. And so if we have an overactive sympathetic or fight or flight nervous system due to a misalignment in the spine, we're actually going to have trouble sleeping, obviously. And so chiropractic specifically takes these misalignments out of the spine to get that sympathetic tone to decrease, absolutely helping with sleep. Second question, does chiropractic help with neuropathy? And the answer to this one is it depends. And so we can have a couple of different types of neuropathy. And basically, neuropathy means that there's pathology in a nerve. And so one way that chiropractic absolutely can help, and so we can get misalignments in the spine that can put pressure on these nerves here. And when that's the case, chiropractic moves that vertebrae back into alignment, taking pressure off the nerve. Another way is that we can have bulges or herniations in these discs where the inner material actually comes out, and that disc will usually move posteriorly right back onto a nerve. And your options are a little bit limited. We can go and do, you can have surgery, some strong medications that kind of keep you from working, doing life, or what we take is a natural approach to let the body heal on its own. We speed that process up to take that pressure from a disc off of these nerve roots, and that can absolutely help with neuropathy. Now, other types of neuropathy include things, we can have all kinds of actual pathology in a nerve. One option could be diabetic neuropathy, and so other things from chronic conditions, neurological conditions such as, multiple sclerosis and a number of other ones. When that's the case, we want to take just a comprehensive health approach to really solve whatever those problems are. But chiropractic as well as a overall healthy natural approach can help with many causes of neuropathy. Third question, can I get adjusted if I'm pregnant, and do I have to stop when I get closer to delivery? And so, great question. You can absolutely get adjusted during pregnancy, and I would recommend it. So a lot of the problems that we see during pregnancy, you're going to have a lot of different problems creep up. As we are going through different stages of pregnancy, we'll have some different issues. One of the first is that as we're starting to put on the weight of the baby, we'll start to often see low back pain. Chiropractic absolutely will help with that. And then also, we start to see anterior shifting of the sacrum and the pelvis, or that looks kind of like this, causes hyperextension of the low back. Chiropractic can absolutely help with this, and I specifically am going to recommend some exercises to help with that as well. One of the concerns, during pregnancy, can we get adjusted because can we lay face down on a table, or what are our options for that? So a couple of things. We use a special adjusting table that's going to lift the pelvis up to allow no pressure on the abdomen. If that's still uncomfortable, we can actually do adjusting laying on your side or laying on your back. So definitely safe and comfortable. And the second part of that is to have to stop when I get closer to delivery. As I mentioned before, we sort of see different problems show up during different stages of pregnancy, and absolutely can get adjusted right up to the day of giving birth, and it's not a problem at all. Fourth question, can I get adjusted if I had back surgeries? Great question here. And so I want to talk about some of the different types of back surgery that we commonly see. And so one thing that's more common now is that we will get what's called a microdiscectomy. Like I talked about, bulging herniated discs where the inner material of the disc protrudes out through these outer fibers, and it's going to often put pressure on these nerve roots here. They use a technique called microdiscectomy now, where they're basically going in and taking that disc material out of there. And it's very, less of it's still a severe surgery because we're dealing with the spine and nerves, but they're not going in there and putting, big rods and a lot of metal in there. And so absolutely can get surgery or get adjusted after this type of surgery. And we don't really even have to avoid certain segments. The way we more commonly used to do disc surgery is they would go in here and scrape out that disc material, but we would put bars and a lot of metal in the spine. And when that's the case, we absolutely have to stay off of these areas because we're not going to move that spine where it's really like screwed into place. And another type that we'll commonly see is what's called a laminectomy, is where there's pressure on the cord in here, there's not enough space. What they'll do is actually take what's called the lamina off the spine, which is this area right here. So we're going to take the back of the spine off through either one segment or multiple segments in the spine. When that's the case, if we take these segments, if we do a laminectomy right here to allow that, take pressure off of the spinal cord in the spinal canal here, we absolutely have to stay off of these segments. We're not going to do a chiropractic adjustment to get these segments to move in the right position, but we just simply stay away from these segments. We can adjust above and below those segments on the spine and still get great results doing that. Next question, top health tips. And so very general, broad question. Let me talk about kind of what is health. And so if we look at health on a line where zero health would be death, what's 100% health, and what does that look like? That answer may be different for everybody, really. And so what I would say 100% health would look like 100% function of all your cells, your tissues, organs, and that's going to allow people to do the things they want to do. And so what is 100% function of cells, tissues, organs? What requires that? What does that require to have 100% function? So the number one thing that I would look at is 100% function of our nervous system. So the actual system that our body uses to communicate and function through our whole body, we want to have 100% function of that system. And to have better function, chiropractic is the bread and butter. And so when we have misalignments in the spine, it's putting pressure on nerves. It's disrupting the communication from your brain to this tissue around the spine and to these nerves. We want to put that segment back into normal alignment so we can allow for normal nervous system function. And that's going to allow normal function of the cells, tissues, organs, allowing for better health. Next tips. So if we're going to have proper functioning cells, tissues, organs, we want to make sure that those cells, tissues, organs have proper nutrition. So we've got to put good nutrition in our body. And we see a lot of different fads, diets changing all the time. Well, I don't want to look at this as a diet approach. I want to look at this as really a lifestyle. The best results that I see in the office in general is we want to decrease our sugar intake, increase our good fat intake, and we want to have moderate protein. That's where we see the best results in general to have good nutrition for our bodies. The next thing that we need to have is oxygen flowing through our vessels. And so we want oxygen to every cell, tissue, organ. And a great way to do that is get great exercise. And so we want to make sure that our body can move and do the things that we want to do. And so the best results for exercise that I see is going to be a high intensity, short duration exercise where we're moving really fast for a short term and then resting. And so we don't need to, lift a whole bunch of heavy weight, but we need to make sure that our body's moving, that our heart's beating, our lungs are breathing the way that they should. And this is going to help, our hormones to function the way that they should and allow, blood and oxygen to get really to every part of our body. High intensity, short duration exercise. And the last thing, we want to make sure that our body's not full of a bunch of toxins and get a bunch of junk. And so make sure we're reading labels and that we're, really minimizing our exposure to really harmful things, whether that's chemicals in our foods or the products that we're, putting in and on our body. So we want to minimize toxins. So just a review on that, we need good nervous system function with chiropractic care. We need good nutrition, we need good healthy exercise, and we need to reduce our exposure to toxins. And so that's our questions for today. Keep those questions coming in, and I will see you guys next time. For more information, go to rockytopchiropractic.com. Call the office 865-444-5994. Thank you guys. Have a great day.